This week in the House of Representatives has been an eventful moment because the 10-year budget measure, which the White House has been pushing since January, made its way out of committee on very divided votes, which again are going to have a big impact on the tax code, our healthcare system, and our nutrition systems, which again, at a time when so many families are struggling with the high cost of food, the high cost of healthcare, and the impending cliff that may happen in terms of tax rates at the end of this year. It should have been an opportunity for a very divided Congress to work together. Instead, we got a hyper-partisan bill. And here's sort of the basic sort of gist. Rather than trying to, I think, balance the tax code, which we know back in 2017 was written to favor the top 5%, top 1%, top 0.1%, and really provided very meager tax benefit for the rest of the country. Rather than address that imbalance, it basically doubled down on that imbalance and extended the low tax rates for that top tier income earners in this country who are not experiencing problems with the cost of food or the cost of healthcare. Incredibly, the income earners below $30,000 over the space of 10 years actually see their taxes go up. And again, middle income taxpayers really, comparatively speaking, get just very modest impact in terms of where their tax status is. What the tax committee also determined is that the cost to the federal government of this tax bill will be just shy of $4 trillion. In other words, it will add to the deficit just short of $4 trillion. This is at a time when the national debt is at close to $40 trillion. We are paying monthly payments on interest of close to $90 billion a month. There were some attempts to offset some of that tax impact in terms of adding to the deficit, but in my opinion, it did it in ways that are almost perverse as far as making it harder for working families, poor families, in terms of the SNAP program, which provides nutrition assistance, particularly at a time of high food costs, that is just so important. The net effect of the bill that came out of the Agriculture Committee shifted the costs of administration of the program to the states. They know that that's going to, along with changes in the program structure, is going to result in roughly about $300 billion of less nutrition help that's going to go out to families. And as I said, doing it at a time when food costs are still high. This bill is so out of touch in terms of what's happening in terms of food costs because, again, it just went in the opposite direction in terms of taking away assistance. In terms of healthcare, the Medicaid program, which is the largest healthcare program in America, it's larger than Medicare. Medicaid takes a $716 billion hit. The analysis by the Congressional Budget Office shows that one change will result in 8.6 million more Americans losing their health insurance. The impact in terms of the healthcare system as a whole is going to be devastating. The hospital associations of every stripe, children's hospitals, Catholic hospitals, the American Hospital Association have all weighed in with vehement opposition because at the end of the day, this is going to weaken the financial underpinnings of our healthcare system. There's a better way for our country to move forward. There's a better way to strengthen our healthcare system and strengthen nutrition assistance at a time when, again, food prices are still persistently unaffordable for so many families in this country, and that is to make a reasonable adjustment to the tax code to make sure that top 1%, top 0.1% who are enjoying historically low rates are actually going to pay a fairer share. And that one measure by itself will completely change the whole dynamic of this process in terms of reducing deficit financing, reducing the national debt, and strengthening families' ability to get the help that they need that we hear about every single day all across Eastern Connecticut. The next steps are that this process is going to continue towards a floor vote. The Speaker says before Memorial Day. The Senate is going to be activating its own process. It is so important for people to be out there talking about the impact of these measures, both for yourself, your family, your community, because that, I think, has really helped in terms of trying to force this measure into a better direction. The needle moved slightly, but not enough in terms of trying to get the right outcome for the American people. Thank you for listening. Again, if you have any questions, don't hesitate to contact my office.